Hello, everybody, and welcome to Distinguished Diseases. In this series, we do a deep dive into a specific veterinary pathogen and look at how it affects multiple species. Today, we're going to take a look at Salmonella. Salmonella is a rod-shaped gram-negative bacteria that affects numerous veterinary species. It is a facultative intracellular pathogen, which means that it must live within the host cells. Almost all cases of Salmonellosis are from serotypes of Salmonella enterica. Unless otherwise stated, all of the Salmonella-related diseases that I mention in this lecture are in this species. Salmonella usually spreads through fecal-oral routes. This occurs when fecal material contaminates the environment, feed, water, milk, etc. After ingestion, the bacteria colonize enterocytes and tonsillar lymphoid tissue. After colonization, some animals are asymptomatic, latent carriers and shed the bacterium in their feces. This image shows the many types of virulence factors that a bacterium may use. The ones that are most relevant to Salmonella are underlined, and they are the fimbriae, secretion system, endotoxins, and flagella. Salmonella use their flagella to help facilitate movement within the intestinal tract. From there, fimbriae help the bacteria adhere to the enterocyte cell membranes. The bacteria can then use their type 3 secretion system to stimulate the enterocyte to absorb the bacterium. This system is like a needle that injects bacterial proteins into the cell cytoplasm. From there, lipopolysaccharide, otherwise known as endotoxin, helps bacterial survival and invasion by reducing the efficacy of the immune response. There are three major clinical presentations of Salmonellosis across species. They are enteritis, septicemia, and a carrier state. However, Salmonella species can also cause abortion, arthritis, respiratory disease, dry gangrene of the extremities, and meningitis. We are going to primarily focus on enteritis and septicemia for this particular lecture. We will start by looking at enteritis. Invasion of Salmonella into the digestive system results in inflammation and diarrhea. The diarrhea results from a combination of chloride secretion, malabsorption, and inflammatory exudates. We will now look at the pathogenesis of diarrhea from Salmonella a little bit closer. Once in the intestinal tract, effector proteins produced and secreted by the bacterium block the closure of chloride channels in the cell membranes. This results in chloride leaving the enterocytes. Water follows the chloride concentration gradient and leaves the cells, resulting in excess fluid in the intestinal lumen. We call this a secretory diarrhea. Other effector proteins recruit neutrophils to the intestine. The activity of these neutrophils induces cell death within the enterocytes. Because of this cell death, the absorptive capacity of the intestine is reduced, and nutrients stay in the intestinal lumen. Nutrients are osmotic and draw even more water into the intestinal lumen, resulting in a malabsorptive diarrhea. Finally, as damage to enterocytes accumulates, there is leakage of neutrophil and fibrinogen-rich fluid into the intestinal lumen from damaged vessels. These components come together and form a pseudomembrane, which is a characteristic feature of Salmonella enteritis. As I just mentioned, the key finding is a fibrinous or fibrinohemorrhagic enteritis. The fibrin forms a pseudomembrane that you can often peel off the underlying intestine. This is a common feature of Salmonella enteritis across all species. Next, we will look briefly at septicemia. In order to cause septicemia, Salmonella must have the ability to survive and replicate within macrophages. Only some ceravars have this capacity. They can enter the bloodstream through the lymphatics. From there, they will either remain in the gut-associated lymphoid tissues or spread to the spleen, liver, and bone marrow. Affected animals may become carriers and shed Salmonella in their feces if their immune system adequately controls the pathogen. However, periods of stress can cause the immune system to relax temporarily, and allow the pathogen to proliferate, which would result in septicemia. Endotoxin from Salmonella in the bloodstream activates both coagulation and the innate immune system. This results in disseminated intravascular coagulation, increased vascular leakage causing widespread edema, and tissue ischemia and hypoxia. Due to these changes, we can see several key findings of endotoxemia grossly. The major finding is multifocal petechiae affecting numerous organs. We can also see pulmonary edema and foci of necrosis in the liver, which are sometimes called paratyphoid nodules. Many septicemic animals will also develop enteritis lesions as well. Now that we understand the two presentations of Salmonella, we can look at how it varies between species. We will start with horses. Salmonella enteritis in horses is caused by Salmonella typhimurium and primarily affects older horses. Many horses are chronic carriers of Salmonella and shed the bacterium when they are stressed. They may also develop diarrhea during these stressful periods. Clinical signs of Salmonella enteritis include diarrhea and fever that lasts for around 1 to 2 weeks. Some horses develop chronic diarrhea that may last for weeks to months. Septicemia in horses is also caused by Salmonella typhimurium, and it primarily affects foals. Clinical signs include fever, diarrhea, and death. On postmortem, you can see typical septicemia lesions like pulmonary edema and petechiae. Foals also commonly develop sequestra of infectious material within their growth plates from the Salmonella septicemia. Next, we will take a look at cattle. Salmonellosis in calves can either be due to Salmonella typhimurium or Salmonella Dublin. It affects calves over 1 week of age. Clinical signs include diarrhea with a foul odor, often called a septic tank odor, as well as fever and dehydration. On postmortem, you can see typical septicemia lesions. One unique presentation of Salmonella septicemia in cattle is fibrinous cholecystitis, where the gallbladder develops a pseudomembrane similar to what is seen in the intestine. Salmonellosis in adult cattle is usually caused by Salmonella Dublin. Most herds develop disease after it is introduced by a carrier animal. Clinical signs include chronic diarrhea, weight loss, and abortions. Cattle may also shed the bacterium into their milk, which has implications for dairy production. At necropsy, you would see typical enteritis lesions, and some cattle may have signs of septicemia. Next, we will take a look at pigs. Septicemic salmonellosis in pigs is caused by Salmonella cholera suis. This condition can affect both young and adult pigs. Clinical signs include blue discoloration and congestion of the skin, dyspnea, and weakness. Postmortem findings are typical septicemia lesions. Enterocolitis caused by Salmonella typhimurium primarily occurs in feeder pigs. It causes fever, yellow watery diarrhea, and distension of the abdomen. One unique finding of this condition in pigs is rectal strictures. These result secondary to ischemia of the rectum that is caused by the Salmonella infection. Ulcerative enterocolitis in pigs is caused by Salmonella typhus. It affects pigs around 2 to 4 months of age. Clinical signs include diarrhea and enlargement of the neck region. At postmortem, you may see caseous tonsillitis, as shown in this image. You can also see button ulcers and intestinal ulceration, as shown in this image. I mentioned button ulcers on the last slide. This is a sign of chronic Salmonella infection in pigs and typically results from either cholera suis or typhus infection. These ulcers are areas of necrosis and tissue sloughing that occurs over top of the Peyer's patches, giving them a round or button shape. Finally, we will look at Salmonella in poultry. Pullorum disease is caused by Salmonella pullorum, and it affects young chicks and turkey poults. Clinical signs include high mortality in young birds and reduced hatchability. At postmortem, you may see nodules in the lungs, liver, gizzard wall, or heart. Fowl typhoid is caused by Salmonella gallinarum, and it affects all ages of poultry. Clinical signs include high mortality in young birds, pale combs and wattles, and diarrhea. A characteristic finding at postmortem is an enlarged, bile-stained liver. Arizonosis is caused by Salmonella arizonae, and this is the only disease mentioned in this presentation that is not a serovar of Salmonella enterica. This disease primarily affects young turkey poults. It colonizes the animal's ovary and is transmitted in the eggs. Clinical signs include diarrhea, ataxia, torticollis, and cloudy and small eyes. Postmortem shows typical signs of septicemia, and some birds may have a purulent exudate in their brain. Paratyphoid is primarily caused by Salmonella enteritis, and it affects young birds under 4 weeks of age. Clinical signs include diarrhea, shivering, and petechiae. At postmortem, you can see typical signs of septicemia, and in chronic cases, you may see inflammation specifically affecting the ovaries. Here is a brief summary table on the different types of salmonellosis in our veterinary species and which Salmonella serovars cause each disease. Thank you for watching Distinguished Diseases. If you enjoyed this video, remember to like, subscribe, and share with your classmates. If you're feeling generous, there is also a link in the description where you can buy me a coffee to help fuel future video making. Thanks again for watching, and we will see you in the next video.